Let's go straight to Brussels, where European Union chief Ursula von der Leyen is now signing the historic post-Brexit deal. Let's go straight. Let's now start off this bulletin, but with some big news coming in from the UK, of course. The country has approved the Oxford AstraZeneca coronavirus vaccine, and this is the second vaccine which has been approved by the United Kingdom after the Pfizer-Biontech vaccine, which was given a go-ahead earlier this month. UK's Prime Minister Boris Johnson has tweeted about the approval, and he said that it is truly fantastic news and a triumph for British science. The UK Prime Minister added that the country will move to vaccinate as many people as quickly as possible. UK's Health Secretary Matt Hancock tweeted about the approval, and in the tweet he said, and I quote, "Brilliant to end 2020 with such a moment of hope. The Oxford AstraZeneca coronavirus vaccine has today been authorised for use by the UK government. The coronavirus vaccine is our way out of the pandemic, and now we need to hold our nerve while we get through this together." This will give a huge boost to the current vaccination drive in the UK, which has witnessed a surge in coronavirus cases driven by a new strain of COVID found in the country. The country has also introduced new restrictions to contain the spread of the virus. The approval of the vaccine by UK's regulator means that the vaccine is both safe and effective against coronavirus. The vaccine will be able to create a significant boost to UK's vaccination drive as it is cheap and easy to mass produce. The vaccine can be stored at a standard fridge temperature, which is good news as well. Now, for more inputs on this, our London Bureau Chief, Mandy Clark, is live with us for more. Thanks so much for joining us, Mandy. Now, this, of course, is a huge turning point in the fight against COVID-19 in the UK. Another vaccine approved, and this time the Oxford AstraZeneca vaccine. Tell us about the significance of this at a time when the UK is in its strictest lockdown due to the new and more transmissible strain.
Well, you're right. It's great news. And the really good news about it is that ease of transport and getting it to the more difficult locations across the country, because it doesn't require that low temperature rate. They've also made a decision. Matt Hancock was just on the radio explaining that there's going to be a bit of a gap. They were planning to have 6 weeks between the first jab and then the second jab because, of course, this vaccine is a 2-dose vaccine. They're going to make it a 12-week gap. Because the first dose does provide quite a bit of immunity that will allow them to immunize more people. Now, he wouldn't be drawn on the number of people that would be immunized per week, but there is discussions that they're looking to try tens of thousands of people per week to get that done. But that is how they're trying to get that rollout of vaccine across the country done much, much quicker, because there is this dangerous new variant that is making a lot more people in Britain a lot sicker.
Right, Mandy, do we know when the inoculation will actually begin and who will receive the jab first?
We do. It was announced that it's next week. It's January 4th that they're going to start the inoculation process. And AstraZeneca was saying this morning that they're already planning to send out those shipments. We do know it's going to be the most vulnerable. There is a tier system that Britain had announced when they first announced the mass vaccination program. They're going to stick to that. That's a lot of care workers, care homes, actually, where the elderly are living. They struggled to get the other vaccine to them, that Pfizer one. So because of the remoteness of the location, the difficulty of transport. So care homes are those priorities. Then it's the elderly, the frontline workers. Then it goes plus 70, plus 60, plus 50, all the way down those tiers.
Right. Now, Mandy, there are, of course, other concerns as well. As we know, other vaccines have shown some adverse effects and allergic reactions among the recipients. So is there any information available to show if this particular vaccine is a safer bet in the long run?
There's, of course, no long-term studies, but we do know it passed all the tests that is required to approve a jab. So they didn't, in no ways did they rush through or miss steps, but we will only find out if there's allergic reactions when they start doing the mass population. In the control populations, in those controlled tests and samples, they didn't see it as of yet, but there is every possibility that in a wider population they will see it. So that is an unknown. And also AstraZeneca said today that they do believe their vaccine as it is created now should be able to tackle the new variant, which is another piece of good news.
Right. Now, Mandy, tell us a little bit about the new strain of COVID-19, which is, of course, making headlines globally as of now, which has emerged in the UK and is now believed to be 70% more transmissible. So what kind of lockdown has been imposed in the UK as of now?
Well, we are expecting that Matt Hancock will be announcing a more tougher lockdown for this afternoon in the House of Parliament. It is expected that it's going to be the northern part of the UK, so Lancashire, Cumbria, the Midlands, all those areas that are currently in a lower tier. London and the southeast went into a higher tier when they first found that new variant, and they found it in Essex, which is the southeast. That has spread and is now pretty much endemic to the country. So the areas that were in lower tiers are expected to move that to that tier 4, which is the highest level of restrictions, just short of a full lockdown that we experienced earlier. So it's the northern England is expected to go into tier 4 today. That's when the House Secretary addresses the Houses of Parliament.
Right, Mandy, describe the scenes in London as of now, where, of course, you're based right now. The world wants to know. The UK has essentially been cut off from the world with travel bans. So how has the government reacted? How are the people in London reacting?
It's still fairly early here. There hasn't been a lot of news, but I did hear amongst peers that, you know, there is a lot of good news to cheer about. There's a Brexit deal, which is a big thing for Britain. There is the new vaccine. There's this vaccine. So there's a lot of reasons to be hopeful for 2021. That is the kind of overall feeling that 2020 was a dark and difficult year. There's a lot of hope moving into the next year. But there's every possibility because, and as Matt Hancock said, we have to hold the line. There is this hope at the end of the tunnel, but this variant is rapidly moving across the country, and there's a chance that secondary schools in Britain will be either slow to open or staggered or maybe closed because of the variant.
Right. Mandy, my final question as we wrap up our discussion. How is the British public taking to the strict lockdown, especially before New Year's Eve? Do we expect empty, quiet streets on this New Year's?
It's most likely. It's also unusually cold in Britain. Normally, Britain's temperature is around 10 degrees. It's hovering around the -0 to minus overnight. 4 degrees. That's very cold for Britain. So less people are out and about just because it's a bit nippy. There is, of course, if you gather and break the coronavirus rules, there are heavy financial penalties. So by and large, people are expected to not go out and celebrate. Is less encouraging than the rather cold weather, but we will have to wait and see if people do hold their nerve, respect those rules, so that there can be a healthy 2021. There's no indication yet they're planning to break it, but we'll just have to see.
Right. All right, Mandy, thank you so much for joining us on this broadcast and for all your insights. WION World is now available in your country. Download the app now and get all the news updates on the move.